Hello. The video today is going to be a little bit different than usual. You may notice that I have a bit of a scar thing going on here. This video falls in the category of too much information for people that don't want to know about this stuff, that have nothing to do with it, and probably good information for those of you that can't find very good information out on YouTube. So back in 2016, I started having a condition of having excess calcium in my bloodstream. Back in those days, I was still doing like Spartan races, training for marathons, stuff like that. I've always been a very fit, off and on been a fit dude. Um, that goes back to being in the Army for 4 years as an infantry guy. The the things that changed were that over time, this condition remained. This elevated calcium level condition remained in place. And in 2021, and I'm going to give you a little bit of the timeline here, my doctor said, this has been going on for a while. The PTH hormone has been normal, but calcium has always been borderline. So if I pulled up like one of these reports from November 16th of 2021, and my calcium level was right at 10.9. The normal range is up to 10.5. My PTH at that time was 5.53, where the normal level was 5.30. And so finally PTH was above the I'm sorry, that was calcium ionized. My PTH was 48, which still fell within the normal range, right? So 15 to 65. So my overall calcium level and my ionized calcium level were both elevated, even though PTH remained the same. But my doctor at that time advised me to do a 24-hour urinalysis, which basically you pee in a 1 gallon jar for 24 hours and then take it to a lab and they give you some results. And as a result of that, I received a diagnosis at that time of having hyperparathyroidism. And for hyperparathyroidism, there is not really any other treatment except surgery. So I looked at my overall health condition. And at that time, I was really just punting the ball, thinking I would get a little bit more data, even though I should have acted at that time. And what happened was I got a DEXA scan. So my first DEXA scan came back with an osteopenia result, and that was in 2022. And so I did schedule an appointment with an endocrinologist at Vanderbilt University Medical Center. I'm here in the Nashville area. And Dr. Baum at that time said, look, he validated basically the results, right? And said, here's what the prognosis is, and I think you ought to talk to a surgeon. Well, I punted, and until I received another DEXA scan. Why did I wait to get a DEXA scan until 2024? Who knows? Just the fact that the symptoms that I was having were negligible. I didn't even recognize them as symptoms, to tell you the truth. So independently, I received a diagnosis of general anxiety disorder, and so I take a little 5 milligram pill for that, which could be related to hyperparathyroidism. Also in 2023, in March 2023, I was learning to canter a horse, which happened to be a former racing thoroughbred, and the horse got away from me, and I went to bail out and ended up bailing out improperly and landing all my weight on my inside left leg and having a distal tibia fracture. But that fracture, within 6 weeks, I was walking on it. It healed up. Again, Vanderbilt University Medical Center. The doctor that I saw here was the was the I don't want to say osteopath. Man, my brain is not working. See, a little bit of the brain fog. But anyway, the doctor for the Preds, and everything healed up fine. So I was like, okay, well, maybe this high calcium thing getting sucked out of my bones is not a big deal. I was in denial for many, many years. I've never had a cavity, and fortunately, I've never still had a cavity. That was the first broken bone I've ever officially had. But in 2024, I decided, okay, the calcium levels continue to be elevated. My general practitioner again. I went in for my annual physical and he encouraged me to get this taken care of. So I had another DEXA scan. And then when I compared the two DEXA scans side by side, it was clear that the osteopenia, the calcium loss from my bones, had gotten worse. And so at that time, I decided, okay, I'm going to act. Made an appointment with the surgeon, had to put off. There were other life things happening that caused me to delay the surgery. And so instead of being able to get it taken care of in 2025, I had it taken care of here in the first couple of days of 2026. So that's kind of my personal backstory. Very few, very few um, indicators that anything was wrong. Every once in a while, my heart would skip a beat, but that's really nothing that ever concerned me, even when I was out doing runs or lifting heavy weights or anything like that. You know, um, I just chalk that up to being a little bit older and occasionally the heart just doesn't, the old ticker occasionally skips a beat. My heartbeat normally ranges between 50 and 60 is my resting heart rate. My pulse ox is good. I'm a healthy dude. My cholesterol occasionally bumps up a little high, and then I just make a diet adjustment. It bumps back down. Never had any major health problems. Had my tonsils out as a kid and have had a couple other minor surgeries, but to remove some sebaceous cysts, which I have a tendency to have from having overly oily skin, which may again be related to this. So went in one Friday, had the surgery done. So the surgeon here, by the way, is great. Again, Vanderbilt University Medical Center. She does multiple parathyroidectomies every week. And so over the course of the year, while I'm kicking the can down the road on this thing, she's been chalking up hundreds of wins, probably. Whereas I am slowly sliding into having more brain fog, the anxiety disorder. I do have a little bit of tinnitus now, but again, I was in the infantry for 4 years, blowing, blowing up things, grenades, lots of machine guns, occasionally doing live fire exercises with Bradleys and even dismounted next to tanks. And so, who knows if the tinnitus is related to it. But definitely was starting to feel a little bit fatigued in the afternoon. So I was up to like 3 cups of coffee to a half a pot of coffee a day. Um, Again, that's not good for your calcium level either. So I kept, treating individual problems that may all be clustered together and related to this hyperparathyroidism. So this day of the surgery, things went well. I'll just tell you what to expect. It was super. Um, VOMC is just freaking a tremendous organization. Can't say enough positive about them, the doctors, every healthcare professional I've had a run in with Vanderbilt. It's just been top notch. Um, they answered all the questions, checked things multiple times to make sure we're doing the right thing, answered my wife's questions. Of course, she had not had to accompany me up until that point. And then went back in there. Was in surgery for 2 hours. And the reason was that they found that 3 of the 4 nodes, so the parathyroid is 4 nodes that are on the back of the thyroid, 3 of the 4 were enlarged and abnormal. So nothing had turned up during the ultrasound, and nothing had turned up during I think it was a CT scan, not an MRI. So it was down to the doctor's experience. And there is a blood test that gets done plus visual observation, but the doctor was able to identify easily that 3 of the 4 here were abnormal. And again, my voice, it's a little scratchy now, but over the last couple of years, my voice has been getting a little bit higher pitched, a little bit more scratchy. So it's quite possible. I haven't talked to the doc, but this will be a question for her in my post-op meeting in another week is, was this potentially impacting my voice? I was joking around with her too. I would like her to lower my voice, but she said they couldn't do that. And I joked with my friends that they said that they would charge extra. But I'm hoping that my voice will be less scratchy in 2 weeks. So they did have to intubate me for this procedure. So one thing that my voice box was definitely sore the first day. I was able to eat after surgery. I had fasted the night before. I was able to take a Chick-fil-A. Chick-fil-A is a big thing here in the South. So I had a Chick-fil-A shake and also had a Chick-fil-A spicy deluxe sandwich, which, maybe that's not the right choice for most people post-surgery, but it was for me. I chopped it up in real tiny, tiny pieces and ate it, one swallow at a time. And they had put me post-op on Oxycontin. I had two pills before I was released, so I was sitting there post-op for about another 90 minutes while they observed me and made sure I was okay and got dressed. And it took them a while to get somebody. It's during the busy part of the day. They couldn't find somebody to wheel me out of there. And of course, they won't let me truck out of there under my own power. So had to wait for the wheelchair guy to show up. But I spent 90 minutes. I know this sounds very disjointed. Maybe I'm still under some brain fog. I apologize. But so after the procedure, came out, was wheeled out, felt a little shaky on my feet. Um, Over the course of the next 24 hours, I had a lot of discomfort in the upper chest. It felt like I had maybe, your lungs had been maybe overexpanded a little bit. But that's gone away within the next 48 hours. So I can breathe fully deep now and my chest doesn't hurt. Pain medication, they gave me six more Oxycontin, 5 milligram, to take one every 6 hours. I took those. I spaced them out a little bit more than 6 hours. And then you can interleave that with, I forget if it's ibuprofen or the other one. But anyway, I took some over-the-counter painkiller too, which also probably helped with reducing inflammation. And so I have weaned myself off the Oxycontin very easily. I took, and again, this falls in the category of too much information. Took the stool softeners, took some Ducalux, um, in addition to stool softeners, and never had a problem with constipation or anything with related to that. Calcium, they do advise you to take two of these smoothies, which they taste like Smarties, just a little bit more chalky and not quite as sweet. But these are pretty palatable to me. You take two with each meal, so morning, afternoon, and evening, and that is supposed to help with your body readjusting, I guess. Definitely, I've not felt any tingling. Occasionally, my hands get a little bit cold and maybe right at the fingertips a little bit. Not really tingly, but just feel like they've been cold. But then again, my body's ability to regulate temperature for a long time now has been very, very bad. I've been very bad at handling the cold for many years now, so I'm hoping that that goes away as well. So the advice is to take these calcium pills for a week. I've started my multivitamin too, so I'm getting enough vitamin D. It is the middle of winter, so the sun was out yesterday. I got some sun in the backyard. Today it's very gloomy and overcast, so I am taking multivitamins so I get the right amount of vitamin D, which helps your body metabolize the calcium. I'm also eating like I've always I've always taken calcium-rich foods, right? I always have two eggs for breakfast, things like that. So my my understanding is based on one YouTube video only, and I did not read this anywhere else. This is bro science, but allegedly this should help reverse the osteopenia. My belief was that since I'm going to be 56 here in a couple of days. My belief is that since I'm still in fairly good shape, I can start lifting again, maybe be less sedentary, go to a standing desk and things like that, do more walking instead of just 2 miles a day, go bumping up to 3 or 4, and rebuild some of that bone loss that's happened. Then get another DEXA scan. I'll run this by the surgeon when I do my follow-up visit. Now, the last part of this I'd like to talk about is the other aspects, right? Did feel some muscle soreness. I was told that perhaps they might have had my arms extended. Again, I've got over here. I've never had a good, good luck with people being able to find my veins when doing IVs or taking blood. So I do have a little bit of a hematoma here, subdural hematoma, but that'll go away. Who cares? Then I did have a lot of soreness day two. It felt like delayed onset muscle soreness, like I'd done a really heavy back workout, back and shoulder workout. That went away after another 24 hours. I do occasionally, like my calves, feel like it's not really a cramp, but it does feel like, again, they're a little bit sore. I'm going to go for a walk today and see how that does. The third day, I went out and took took the car out and went for a little bit of a drive. Went to church since I'm off work this week, and I was able to turn my body. I kept my head pretty much non-moving for the first 3 days. Um, Probably overdid it, but now I can turn. I'm turning it just, a little bit, and then tomorrow I'm going to start stretching it out a little bit. I can look down, I can look left and right. I can walk around without my muscles being tense. But I think, my shoulders, my lats were always kind of tensed up there the first day or two where I was trying to stay very, very immobile to let things kind of heal up. And I did feel some numbness above, and I still got some numbness right above where the incision point is. If I pat this with a towel, there's a little bit of pain, so I'm trying to avoid doing that. But so far, recovery looks to be pretty good. And the intubation, I'm hoping that my voice box will recover. I shouldn't be talking this much probably. I'm doing a little bit of tea to help soothe it. And yeah, that's it. That's my story. So I hope this helps. Oh yeah, so hyperparathyroidism affects mostly females. So it's like an 80-20. So 20% of males. And again, with surgery, oftentimes they'll detect with ultrasound or with a scan up front which nodes are abnormal. And of course, a good doctor is going to visually inspect all four nodes to make sure. But usually it's just one that's overactive, and just one has to be um, excised. But in my case, I had three, and so once again, that falls into that small percentage. So I'm a small percentage of a small percentage. I'm like 1% of the. I'm like a 1%er. So you're likely not to be under the knife as long as I was. And again, my doctor tested, drew blood, and tested to make sure that my levels of parathyroid hormone had returned to normal before taking me out of the OR. So I suspect that everything is normalizing, and the fact that I'm not having muscle cramps or tingling or anything like that. Um, Sleep. I will say that the first night I didn't get a lot of sleep, and last night I only have been kind of a light sleeper, get 5 or 6 hours a night. So again, nothing has changed here. Maybe afterwards I'll go back to sleeping on a more normal schedule. But then again, I like the excess productivity that I have from being able to sleep for only 5 or 6 hours, like Arnold Schwarzenegger. So um, your mileage may vary, but I'm a very small outlying case. But I did not see, I only saw one other guy talking about his experience with this particular problem. And so I thought I would put my voice out there again. Oh, wait a minute. It was the second guy. There was one dude I saw that was younger. Then there was like an old dude that had like three and a half of his excised and went out golfing like 3 or 4 days later. So, yeah, I just wanted to put another voice out there. Anyway, I hope this was useful to you. Feel free to comment, ask me questions. I'm not a doctor. Don't play one on TV. Don't pretend to know much more than what I've read on the internet and seen. Now that I had the surgery, and was looking at a couple of YouTube videos. Go figure. I stayed in denial for many years. Don't don't be like me. I understand for other people it can cause kidney problems, kidney stones, and some more severe manifestations than what I underwent. Anyway, hope this helps. Goodbye.